Nebivolol is a beta-blocking agent used to treat hypertension and aid in the management of heart failure. In this video, let's find found. What is nebivolol? What is nebivolol used for? Contraindication. What are the side effects of taking nebivolol? How does nebivolol work? How to use nebivolol? What is nebivolol? Nebivolol is a beta blocker used to treat high blood pressure and heart failure. As with other beta blockers, it is generally a less preferred treatment for high blood pressure. It may be used by itself or with other blood pressure medication. It is taken by mouth. Nebivolol was patented in 1983 and came into medical use in 1997. It is available as a generic medication in the United Kingdom. In 2020, it was the 239th most commonly prescribed medication in the United States, with more than 1 million prescriptions. What is nebivolol used for? Nebivolol is indicated to treat hypertension. Contraindication. Nebivolol is contraindicated in people with hypersensitivity, severe hepatic impairment, cardiogenic shock, sick sinus syndrome if no pacemaker, 2 degrees per 3 degrees heart block if no pacemaker, bradycardia, HR less than 50 beats/minute, decompensated heart failure, severe hepatic impairment, Child-Pugh class C. Side effects. Nebivolol use can result in severe bradycardia, heart block greater than first degree, patients with cardiogenic shock, decompensated cardiac failure, sick sinus syndrome unless a permanent pacemaker is in place, patients with severe hepatic impairment, Child-Pugh class B, patients who are hypersensitive to any component of this product. Pharmacodynamic. Nebivolol is a selective beta-1 adrenergic receptor antagonist that decreases vascular resistance, increases stroke volume and cardiac output, and does not negatively affect left ventricular function. It has a long duration of action as effects can be seen 48 hours after stopping the medication and a wide therapeutic window as patients generally take 5 to 40 mg daily. Patients should not abruptly stop taking this medication as this may lead to exacerbation of coronary artery disease. Diabetic patients should monitor their blood glucose levels as beta blockers may mask signs of hypoglycemia. Mechanism of action. Nebivolol is a highly selective beta-1 adrenergic receptor antagonist 2 with weak beta-2 adrenergic receptor antagonist activity. Blocking beta-1 adrenergic receptors by nebivolol leads to decreased resting heart rate, exercise heart rate, myocardial contractility, systolic blood pressure, and diastolic blood pressure. The selectivity of nebivolol limits the magnitude of beta blocker adverse effects in the airways or relating to insulin sensitivity. 0.5 Nebivolol also inhibits aldosterone, and beta-1 antagonism in the juxtaglomerular apparatus also inhibits the release of renin. Decreased aldosterone leads to decreased blood volume, and decreased renin leads to reduced vasoconstriction. Nebivolol is responsible for beta-3 adrenergic receptor agonist activity that stimulates endothelial nitric oxide synthase, increasing nitric oxide levels, leading to vasodilation, decreased peripheral vascular resistance, increased stroke volume, ejection fraction, and cardiac output. The vasodilation, reduced oxidative stress, and reduced platelet volume and aggregation of nebivolol may lead to benefits in heart failure patients. Half-life. Nebivolol has a half-life of 12 hours in CYP2D6 extensive metabolizers and 19 hours in poor metabolizers. Dose. The dose of this medicine will be different for different patients. Hypertension. 5 mg per day (PO) may be increased every 2 weeks, not to exceed 40 mg per day. Safety advice. Pregnancy, Category C medication, unclear if nebivolol gets excreted in breast milk, however, Beta blockers can cause serious adverse reactions in nursing infants, example, bradycardia. That's all the information about Nebivolol we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.